So I'm very pleased to introduce this evening's speaker. We are joined by Professor Martin Griffiths. Professor Griffiths is a consultant trauma and vascular surgeon at Barts Health NHS Trust, where he developed the nation's first ward-based intervention programme for victims of interpersonal violence. Martin is also undergraduate dean at Barts Health. Martin is the clinical director for the London Violence Reduction Network, NHS London, leading the expansion of a public health approach to violence reduction across the capital. His interests include the integration of peer groups into the co-design of community and healthcare based prevention and education programmes. Martin is an ambassador to the Mary Seacole Trust, chair of Shift UK, a trustee of Charlton Athletic Community Trust, vice president of the Hope Collective, and a deputy lieutenant of Greater London. He was also awarded a CBE in 2021 and an honorary degree by BSMS in 2024. So Martin, thank you so much for being with us tonight, and I will hand over to you.
Well, thank you, Agatha, for the wonderful introduction and the very padded CV. I hope you can hear me all. As you can see, I'm in my upstairs office with my Charlton Athletic poster and my Catford flag behind me. I'm very proud South Londoner. So what I thought I would do for the next 40 minutes or so is talk you through a bit about who I am and where I'm from, and then as a sort of like a piece around it, I'd also like to just talk to you about one of my deployments with UK Med in Gaza I went to in September of last year. I think that'll give us about 40 minutes of time, and then we can have some chat and questions after that. That'd be all right. So, who am I? Right, my name is Martin Patrick Griffiths. I am 60 years old. How old am I? I'm from South East London, and I am a consultant trauma surgeon. I am also a violence reduction advocate. I'm also a humanitarian, and I'm also an educator and trainer. And I've been doing these sort of things over the past few years, and I sort of fell into it all. So it's interesting that we all get trained to think we're going to be one thing, but my career in medicine has taken me from vascular practice through to trauma practice, through to practice in austere environments and conflict zones, through to education and training, both postgraduate and undergraduate, and also into the field of violence reduction, trying to understand the causes of violence in our community and put in place programs and understanding that, reduce that, and make London and the nation a safer and happier place. So that's an awful lot of things we're doing, and it didn't all happen at once. It's all kind of iterative, and I wouldn't say that I'm particularly exceptional. I've just been kind of fortunate and been very keen to kind of just try stuff. So impact wise, it's fair to say I've been quite active in my many years. I've done quite a lot of clinical practice and looked after lots of patients. I've been part of innovation in terms of education, training, how we conceptualise what violent injury is, and how we support young people who are victims of injury so they don't get injured again, don't get involved in retaliation, don't be involved in the criminal justice system, as well as providing great care. And that's led on to building bigger systems around how we support the understanding of violence in community, how the NHS understands its role in understanding how we as a body can support activities that allow people to live happy and healthier lives free from violent acts. And that's interpersonal violence, domestic abuse, child abuse, all the things you hear about, but they often have common core origins, which I'm very keen to explore and work with community about. And I'm all about community. So where am I from? I said before, South East London. I'm from Lewisham, Brockley, and it's lovely now, but it wasn't quite so lovely when I was born back in the 60s. And I grew up in a single parent family in South East London. I'm very proudly Jamaican and British in that order. As you know, follow West Indies cricket, but then support Jamaican football, unless they get knocked out, because I support England now. Very, very, very bad of me. Ultimately, okay, I think I came from a family with very little exposure to education or higher function. My mum worked as a healthcare assistant, and as I said, and I grew up with my sister in social housing in South East London. I wasn't really inspired to be a medic, and I always planned to be a aircraft mechanic and join the RAF when I was younger. But I sort of fell into medicine as a sort of like a gimme with my mum after doing fairly well in my GCSEs and agreeing with her to stick on to do A-levels. For some reason or other, I was persuaded to apply for medicine because I thought it would be something, because my mum had told me how great the doctors she worked with were, and I was kind of keen to emulate that and do something that was sort of public facing and service delivery. I never thought I'd get into medical school because obviously I'm an idiot, but luckily enough I got into place, and the rest is history. Medical school wasn't very straightforward for me. I was the only black kid in my year, actually only black kid in my medical school, and I went to Barts, which is a very austere, old-fashioned place back in the day, and that was a little bit clunky, a little bit racist, and a little bit scary. And it's not like it is nowadays, much more in terms of participation and understanding. That being said, I was quite fortunate. I was good at rugby. I was quite good at fighting. I was quite lippy, and I got on well with a very small medical school group and had a really brilliant time at medical school, weirdly enough. And I made my best friends there, and I graduated in the early 90s with a couple of degrees and a bit of an attitude. I went into surgical practice because I got honours in surgery. I went into trauma surgery and vascular surgery because it was harder than anything else. I was kind of keen to improve myself. And as time went by, I did research, got my big consultant job after working for a couple of years, and started working in a major trauma centre in Whitechapel doing vascular and trauma surgery back in the early teens of this century. And I got into violence reduction as I was looking after young boys and girls who been shot and stabbed, and was really frustrated by the readmission rate, and built a program around that, supporting those individuals using colleagues from third sector from charity called St Giles's Trust. That snowballed into a really effective practice, reducing readmissions, and from that I was asked to do a piece of work in the London system, which led to a role in NHS London in 2019, and then a role as a National Clinical Director, quite a big job, in 2020, which I had for about 3.5 years. And then interim period of that, I moved into other bits, doing more work with other agencies, policing, the Violence Reduction Unit, education, etc., and doing policy work as well. Meanwhile, my clinical career cracked on as well, and I did lots of work around. I was very passionate about training and education. I found my training process quite arduous as a postgraduate student. I was very keen to improve the outcomes for trainees in difficulty, which I was, and for individuals who come from diverse backgrounds. I'm a working class kid with not little way of medical expertise or knowledge. So I struggled quite hard to embed myself in that culture. So training was challenging, and I found that quite a difficult ride. That being said, I had brilliant support from strangers and friends alike, and ascended to a really good job working at a major trauma centre and teaching hospital, and I've been there for quite a long time doing lots of great stuff. You notice I'm a professor. That's something I got a couple of years ago from my university QMUL. I've also been a senior clinical lecturer at BSMS for quite a period of time, and I've been lecturing down here for over a decade now, where I've been teaching on a public health course about violence and violence reduction in my role as an educator, and that's been a really brilliant journey, and I love every part of what BSMS brings to medical education and to people in and around the community. So that's sort of masterly things. In terms of my philosophy, I'm a bit of an optimist, actually, relentless optimist, and I'm massively into taking risks and chances. If everybody offers me an opportunity or a dare, I always take it, on the grounds I don't mind failing, but I do mind not trying, and I encourage that in my colleagues and my kids as well. In terms of skills, I haven't got very many. I'm good at most things. I'm quite affable. I'm not a bad communicator. I'm a fairly decent pair of hands technically. I'm not the stupidest person in the room by and large, but I am in my own house, obviously. And I have got a knack for seeing problems in a different way. So each of my skill sets, okay, I'm good at most things, but in the scenarios I find myself in, having a combination of all those skills is quite unusual. So being good at most of those things is good enough to make you excellent in that kind of a role. I've been quite fortunate in finding roles that allow me to be innovative and difficult and challenging, and ask those awkward questions. My two questions are always going to be why and so what. That's where I've come from, really. It doesn't matter who I actually personally live. I live in North London with my wife and my two boys. They're 11 and 16. They're both in and around the education space. Both of them don't want to be doctors, which I'm very pleased about. They want to be. One wants to be a police officer, which my father will be interested in, and the other one wants to be a YouTuber, obviously. In terms of the future, I suppose I've been really interested in doing a lot of charitable work, and I'm a big fan of Charlton, part of their charity. I've done some work with organisations like Shift, and who are interested in supporting youth in and around the criminal justice system. And I've been deputy lieutenant. I work for the monarch, representing the crown in certain kind of ceremonial things in the honour system for a period of time. I suppose, and in years to come, I hope to do some more of that work to support community by doing things on a broader narrative as to how I can support young people in being aspirational and successful in those spaces. I think, for me, the journey in medicine has allowed me to be a lot of things I thought I never would be. To explore my own personality, my own foibles, my own trauma. To be more curious in nature and to travel. God, I've travelled loads of places in the world and to meet amazing different people. It's been really, really, really fascinating and fantastic. And I can't recommend to you enough what medicine is. It's a brilliant career. It's really exciting. It's really challenging. But you get the chance to serve a community, do amazing, incredible things, and to learn loads about yourself and what we do. So that's me. I'm going to try and find a talk because I want to talk to you a bit about what I've been doing in my spare time. So when I'm not a practitioner, okay, I am a humanitarian. And this is a picture. And I went to Gaza last year, just before the ceasefire, and worked with a charity called UK Med, who are the government's NGO, the UK PLC, who were deployed to southern Gaza in the bit when they were trying to flatten that area. And I just want to talk about my experiences there. This is me looking obviously a bit browner than normal in front of one of the few working ambulances in Gaza at the time. Right, so this is me. This is a bit more clear. This is me on the tube, and this is me on the right hand side with Seba, one of our interpreters. She's absolutely brilliant, and she got me through my Arabic lessons while I was working there. So as I said to you before, my roles are quite interesting. I'm a clinical practitioner. I'm an advanced reduction advocate. I'm a humanitarian, and I've been working places beforehand. And the humanitarian work started sort of like 2015 onwards, where I was really attracted to working with organisations who were doing work in and around communities affected by sudden onset disaster. But I found myself first of all deployed to South Sudan doing a training mission back in the days when it was quite punchy in the middle of the civil war there. And that led to me being part of the community of practice and then being asked to go out to Gaza in 2025 to support the delivery of surgical care to a small hospital in southern Gaza in a place called Al-Mawasi, which I'll talk to you about in more length. Okay, hang on. Oh, crikey, me and technology are never good, are they? Right, brilliant. Right, brilliant. Okay, so UK Med is where I work for, and they're probably the preeminent NGO providing clinical care. And what we do is we work with communities affected by sudden onset disaster and conflict to deploy skilled clinicians who work with the clinicians in the local area to provide really good capacity, and we provide great clinical care in those spaces. We treat people on their clinical need rather than political reasons. We are very apolitical. We've been all over the world, and we work with the big agencies like WHO and UNICEF to make sure that we're providing pieces around it. Our practice is to design and deploy field hospitals and provide surgical support, and if need be, align with other services providing more higher levels of care. We're really, really not interested in working in isolation. We work very much with community, and it's really important to us that we apply ourselves to supporting local need and capacity to work holistically and coherently with existing services to make sure that we can provide infrastructure and support. A lot of what we do is logistics rather than just doing bits and pieces. It's kind of important to appreciate that bit around us. So we've seen lots of, and in Gaza has been pretty active. We've been there since the first gunshot went off, and we've been treating lots and lots of people. We've got a lot of central government funding, and we've got a lot of experience in working places. And previously we worked only sudden onset disaster, but in the past decade there will be more and more conflict zones, which obviously adds a tier of concern in terms of our well-being and safety and our ability to provide care in that regard. So, okay, what do humanitarians do? It's a good question, actually. And I think what we're there is about humanitarian practice is very interesting. It's not about picking favourites or doing what you fancy. It's really about actually protecting community, okay, from the outside, from the effects of the austere environment, what's happening to that community. And it's reducing suffering. It's about promoting health and well-being, and also doing it in a dignified and collaborative manner. What we do not do, what we must never do, is pick side, and that can be very difficult when you're in conflict zones, when you're being threatened and you see things, people having a pretty hard time of it. And we treat all of our patients on the level of their clinical need, not their political need. So if someone is injured, okay, and is a combatant, and okay, it's right to being an enemy, we will treat them first because they are sicker. And we look after people who will normally not be treated by one side or another because they need treatment and care. And we provide a neutral, safe space for that care to occur. And we are impartial. We don't take a decision on who does what to whom. I have a very, very strong personal affinity to what's happening in South Sudan and Gaza, but that doesn't affect my practice. It's important to me that we are impartial, totally impartial. That's kind of hard to do as time goes by. And we're independent. We don't work. We're not at the beck and call of a political party or a government agency. We do what is right for the people around there. We are funded to be an NGO, and it's really important to us. We are free of political and military influences. That can be quite challenging when you're working around angry people with guns, but it's about being consistent in your approach and in delivering care in a reasonable and appropriate manner. So our care absolutely is needs-based, and that's not negotiable. We don't get to choose who we engage with. We don't get to choose who we like and don't like. We do the work and we come out, and that's what we do. And our practice is to do that work as well as we possibly can. I suppose it's kind of difficult, okay? So we have to do bits of work around there. This picture here you see of a young man who's received gunshot wounds to both legs, and he actually was a looter who was taken outside, made to make an apology video, and shot by a local militia for being a thief. And the local government wouldn't treat him, local hospitals wouldn't treat him, the COGAP wouldn't treat him, no one would treat him apart from us because they regarded him as being a low creature. And that isn't the issue about that. I recognise people do things for all kinds of reasons, but he required care. That's what we did. And we have to be not aligned politically, maintain confidentiality, and treat people with the clinical means around it. Now, that's really hard when you've got issues around logistics, around water, heat, medicine, access to fluids, access to blood and products, okay? And it's an insecure environment. There's constant gunfire in and around the area. And when you're working in conflict zones, you're quite close to live action, and you can be quite close to shelling, which can be quite difficult, which means that you can be involved in humanitarian issues that relate to that conflict, which is very close to hand. Yeah? I think we really are, and also because we hold ourselves to a very high standard in terms of our practice, we do not do harm. We do not do what we think is appropriate. We work in and around the cultures that we're working with. And it's important that we have those conversations to make sure that those things are occurring appropriately. We are ethically appropriate. We are confidential. We use the best evidence to provide care in that limited environment, and we always work with consent. And we work very strong with advocates in the spaces around it. And our standards are internationally met and led, and we work to that standard irrespective of the circumstances around us. It's really important we hold ourselves to a very, very high standard of practice, and we are always impartial and pragmatic. So, okay, let's go back to Gaza. So 2025, all got very messy there, okay? And the biggest problem with Gaza wasn't so much just the conflict, but the lack of resource getting into there. So no food and aid was getting into there in significant numbers. So there was a significant issue with malnutrition, access to care, and hygiene, because as part of the shelling, the entire infrastructure of Gaza had been destroyed. There was no sewage, there was no electricity, there was no water, there was no anything. So people were basically living in and around rubble for large parts of those time. That led to large amounts of disease and people who were really difficult to support. And because of the way in which the aid was structured, quite a lot of security around there, and unfortunately some people were killed in and around the efforts to try and obtain food from either aid stations or from convoys, etc. So in Gaza was a bit of a mess in terms of the population being displaced, and the fact we lost so many of the hospitals. We either shelled out of existence or ran out of resources. So the majority of the hospitals in Gaza were lost. And when I was working there, the only standing trauma centre left in Gaza was at NASA, which is about 5 km from where we were working. Everything else had either been destroyed or was provided by other agencies. And I think that we put ourselves in the middle of Gaza and southern Gaza, because the north had been covered, Gaza had been covered by other agencies. But there was no health structure. There are only 6 functioning ambulances left in Gaza when I was there, and there was a lot of disease caused by poor sanitation, poor sewage, and infectious diseases were really problematic because kids hadn't been vaccinated for a couple of years. So that was the context, and I remember when I got the phone call, I was told it wasn't that dangerous. The word "that" was quite important. So I got another conversation. I had a chat with the fam, and we talked through the risks around it. My partner, wife, was deeply uncomfortable about me going to Gaza. We had to have a couple of serious conversations, and we had to meet with the people in Gaza to make sure that their safety, my safety was paramount in that regard. I got a leave of absence from work, went to Gaza early September, and they only get a month to do there because of work constraints, and also because of the psychological impact of working in those spaces. You can't be there for that long without getting into real problems. And you work in the area around that sort of stuff. And for me, the driver to do the work in Gaza wasn't because I felt like some great need to be a hero. It's because I had this incredible set of skills, hard-earned skills, which I developed over years of clinical practice. I was a really experienced trainer, really experienced practitioner, really experienced communicator, and really experienced lead. And I felt that those skill set would be really well deployed in an area like Gaza, where a lot of the senior staff had been killed or were absent, and where they need to have some people around there to help support some brilliant clinicians in those spaces that weren't getting the support that they needed. So the mission in Gaza, this is a picture of me operating on some lad. We had 3 sites there. The one where I was based in was Al-Mawasi, a field hospital, which was in southern Gaza, quite by the coast, not far from the Egyptian border, which is basically the emergency hospital with surgical capacity, and we did kids and babies as well, and rehab. It was built on tents, and although it was initially supposed to be a 350 bedded capacity unit, it ended up having 1,000 when I was there. We also had a field hospital in Deir Balah, which is the middle of the country, which was primarily primary care, GP work, looking after a largely displaced population, and that population increased exponentially as the shelling of Gaza City reached its peak, and Gaza City was essentially erased from that part of the world. And then also we did a lot of work supporting NASA, which was obviously the major trauma centre about 5 Ks in Han Yunis, and we provided the emergency department staff and leading there, and we provided a lot of care in that regard in terms of infrastructure, leadership practice. I spent a few days there doing some higher end vascular care with some people who needed some expert vascular surgery, which I was happy to provide when I had some time and wasn't doing work in the field hospital. So, how did you get to Gaza? Back in those days, you had to go in via Jordan, as the approach by sea was guarded by Kogat, and you couldn't get into Gaza as a humanitarian via Israel. So you fly into Jordan, into Amman, and you travel by road initially through Jordan to King Hussein Bridge. Then you get into a blacked out lorry and travel under armed guard through Israel. Then you enter via Gaza at the Kerem Shalom point, then you enter into Gaza, go through the actual fighting zone in southern Gaza, then they drop you in Deir al-Balah and go from there. And when you're in the actual spicy bit, you have to wear your PPI, your helmet and your body armour whilst that bit's happening, and you carry that around when you're outside the compound. So that takes around about that convoy goes off like twice a week, and the journey takes all day. Often it gets cancelled or turned around depending on security concerns, and it's an odd experience going from somewhere lovely like Jordan, where you're getting a lovely hot dinner and chicken and chips, to finding yourself at the end of the day in the middle of a war zone with constant shelling. It's a bit of a trip, but it is what it is. So, okay, fine. So when you get there, right, this is a picture of Gaza City when I got there. You can see it's not looking brilliant. There isn't really high buildings there. It's all grey. It's all been shelled, pretty much flat. All those buildings are uninhabited because they are a risk of collapse. We're here, in theory, to protect civilians and facilities, to provide a conduit for aid, and to make sure that the agencies are acting in the appropriate manner, and we are neutral. Okay. In practice, however, given the nature of conflict in that area, the hospitals were constantly getting shelled. We received a few rounds in and around the compound. I remember finding a stray bullet in the box of gloves I was trying to open. So the bullet obviously traversed the compound, and it's we lost one of our nurses was shot in the head on my last day there. I think as a stray round. Facilities are always overcrowded because people are trying, because it's a place of safety, and we are obviously human shields because we're neutrals. No one kills us as such. So we tend to be very overcrowded, and people tend to congregate around our compound because it's the safest place to be. By and large, food and stuff doesn't always get in because the convoys are either blocked or delayed for lots of good and bad reasons, and there's very little in the way of deconfliction, and a lot of people get killed. It's interesting to notice that the people who are dying from the healthcare perspective are locals. They are Gazans rather than UK people or people from other parts of the world. And we lost pretty much all of our physios in the first sort of wave or two of its situation. Lots of our staff were being attacked. We lost a couple of doctors who were shelled at NASA whilst I was there. As I mentioned to you previously, one of our ED nurses received a wound to the head the day before I left. So what's it like in Gaza? I chose to stay in a tent rather than inside the actual provided accommodation inside the compound, on the grounds that 1, it was really hot, and 2, people were snoring, and 3, as a COGA, have the entire area mapped out anyway, whether I'm inside a building or not. It doesn't matter if they choose to shell it. So you get to bed around about 10ish, and you wake up around about 4 o'clock when you hear the shelling of artillery fire in the middle distance. This is distant. The coastal batteries and also stuff going into Gaza City, jets, etc. And I get up in the morning, have a quick shower, do a bit of writing, do messaging, send some videos to my kids. We had internet access there, it was brilliant. And then maybe a little chat, and then at 8 o'clock do a ward round on the hospital and see all the patients. And we came in overnight and do some work and crack on through that. And that's pretty arduous. And then I operate all day and I do general surgery, just doing boring stuff like appendixes and debriding wounds, and also do the blast stuff and the penetrating trauma stuff and the gunshot wounds, etc., and the fractures and also the mass casualties. So there's lots of stuff going on. Most of what we see is wounds for people who are very sick, who are very malnourished, with lots of dirty wounds, having travelled miles to be with us, and those people tend to do really badly in terms of outcomes. At 8 o'clock we do a late round, and we do some plans for the night. Then we go off to bed, and I will consult overnight with anything that comes overnight that needs an operation. To anybody who gets a traumatic injury, I'll normally join the night surgeon to do the case with them, and we did a couple of things, 2 or 3 things over that period of time, and a couple of mass casualties. We had 30 or so coming at suddenly with a shelling in a village, etc., which caused problems. And then about 10 o'clock, we all have to debrief over a cup of tea, and then we went to bed and tried to get some sleep. Don't worry, we all got fed. There's lots of carbs there, not a lot of protein. We all had a meal every day, 1 hot meal a day, and the hospital provides hot meals to all the staff, so it was good in that regard, much better than outside. So, what's it like working in Gaza? Well, where I work at Whitechapel, it's fantastic. It's helicopter, CT scanning, MRI imaging, blood panels. Everything is there, hot and cold running people. It's fantastic with wards, etc., intensive care. Al-Mawasi, none of those things exist. I have to examine it with my hands, see what's going on from there. There's an X-ray machine that works periodically. Our nearest CT scanner is 5 kilometres away through areas that are quite dangerous, and the nearest neurosurgeon is 5 kilometres away. It's pretty grim to get there, and it's not easy to do that work, okay? I operate on my clinical expertise rather than any access to CT scanning, etc. And there's no ITU cover, so if they're very, very sick, either I ship them or I don't do them. And there's no kit, there's no antibiotics, there's no other kind of drugs, there's no anaesthetics, stuff with lots of pieces, and all the stuff we're using has been used 1,000 times. It's been put together with gaffer tape or whatever it might be, and it's all a bit knackered. And we could tell you to the nearest tablet to how much antibiotic or how much pain relief we had in their situation around that. And it's difficult to work in their space with individuals who lack the access to those devices. As I said, it's a tented hospital, so everybody's in a tent. It's dusty, it's dry. We have air conditioning, but it's not perfect, and the power cuts out once or twice a day, which makes some things kind of challenging, like anaesthesia and surgery. Okay, fine. Let's talk about some patients. The pictures I appreciate can be a little bit gory, but I also want to try and explain to you where I was in this scenario. So you see me with that beautiful little lad who received a shrapnel wound to his chest whilst he was with us, and he had a punctured lung and was walking around with a little chest drain in and came under our care. The reason I have a picture with him is not because he's beautiful and gorgeous, but because when he was discharged, he was killed a week later. And the reality of doing trauma care in our work is that people die despite our best efforts. We sent him home to his tented village, and he was shelled and he died. And it's very, 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 very hard to deal with that. The middle picture shows what we look after. This is a young child who received a nasty injury, and their family had dressed her wound with dishcloths. And that's what they used. They had no access to anything else, and a dishcloth, and I think some masking tape with the leg dressing. You can see some gunking at the bottom of it, and when you're looking after people who are malnourished, who are receiving imperfect care, this is what you see. And this poor child had been traumatised, had lost most of their family, was 12 but looked 6, and had really, really nasty wounds, and was really slow to heal, and had a huge amount of psychological trauma we couldn't really address in absolute terms. The third picture is a picture of a lad who sustained a really straightforward injury to his toe, which, had he been in the UK, if had some antibiotics and the dressing, he would have been fine. That lad lost his leg because we didn't have access to the right antibiotics and the right stuff, and the wound got infected, and he ended up having an amputation. Now, that would be bad enough in the UK, but bear in mind there are no physios, there's no occupational therapists, there's no rehabilitation, there are no prostheses, no false legs in Gaza. So that's consigning that young man to a very difficult future, which I wasn't pleased about. But this is how things work. You haven't got resources, you haven't got kit. So, what's important to appreciate is that though I am a healthcare practitioner, the majority of clinicians in Gaza are Gazans. And this is the team I was working with in my Monday and Tuesday lists, with my nieces to the right and the 2 scrub nurses in the middle and left. And they are brilliant, brilliant people. We had a right giggle doing work, which sounds crazy, you know, when you're constantly under shell fire. But these guys are incredible. They have had everything taken away from them. Their careers, their lives have been taken away from them, their family being taken away from them. They get peanuts to pay, and they can't get out of Gaza. They can't get out of Gaza. And yet they come to work every day. Some of these guys are coming from Gaza City and getting in the bus at 5 o'clock to get there at 7:30, you know, and some of these guys are going back to a place that's being shelled and coming back the next day. It's absolutely berserk. And we managed to get most of our staff, we moved them down from Gaza City to live in and around our compound in that period of time to make sure they were safer. We've got them and their families there. But things are so expensive in terms of how they have to get tented and pay for water, electricity, that the money they were receiving from us barely covered their expenses. And yet, they still turned up. And yet, they were still incredibly kind. And yet, they helped me improvise with bits I used to do. And yet, they were really dedicated, incredibly dedicated to providing care for that community. And they were kind and gentle and funny. And it was blah. And I learned so much from these people about humility, about practice, about what it means to be a true clinician in the worst circumstances, how you put your own trauma to one side to support individuals who are having a worse time than you. And I found it an incredibly uplifting and wonderful experience working with them. And they are great people who I still WhatsApp and text on a pretty weekly basis. So you might quite rightly recognise that working under a constant shell fire, with people dying for kind of weird reasons and with no infrastructure, is quite taxing on your mentality. And you get real strange feelings of guilt about not being able to do more, about lack of resources, about what you're seeing and unable to fix. You also get a lot of, because you're witnessing a lot of suffering, a lot of children particularly who are dying for not particularly good reasons, makes you feel quite hard about what's going on. And you feel very guilty because you can leave after a month and go back to Amman and have a chicken and chips that night, you know, whereas the people there cannot get out. And you have a chat with people, you talk with people about stuff, and we have a share stuff, we share sweets, and they say to me, can you get me out? And the answer is no, I can't get you out. And you know what? It's every day, it's relentless. You're doing 12, 14-hour days. You're getting a couple of hours off a week, you know, on a Friday. It's not quiet, it's not easy, nothing good ever happens. It's just and it's a really tough bit around it. So people, if they're not supported, they get very blasé and cynical. They become quite twitchy, and they have these really weird thoughts and feelings, and they get quite grumpy. And it's really important to appreciate that when we had a lot of psychological support before, during, and after our deployments to make sure that we felt well, felt great. well, not great, but better than we would have been. And it's important to appreciate, okay, that we had all the support, okay, we gave it to all our staff as well, who are, you know, the bulk of them were Gazans, and made sure that those people felt they were supported and cared for and could share and tell their stories. Like I said before I went out, a lot of psychological briefing and healthy around that. During the mission peer support meetings, and we were talking about stuff all the time, post-employment, mandatory rest, mandatory meeting with psychologists, mandatory sitting with people, and long-term, a period of time to share the stories. It's taken me about 6 months to get my head around it, to start sharing the story about what I saw, what I did, and how I felt about it. And then when I got back, it was really, really interesting, actually. I'd been back, I had a week or two off, and I was having these memories of working in this really trashed, tented hospital, working in NASA, doing really big cases, having to be super careful with my suturing and being constantly worrying about my well-being, and then going back to Whitechapel, you know, with people worrying about not having the right lights and moaning about the fact that it was slow to get kit, and they were, you know, being worried about the bits and pieces, and no issues around safety and security, and literally having everything around you, and it felt very weird. I remember when I struggled a little bit initially with the sound of children making noises, because I've been so used to children screaming that going back to a coffee shop with a kid playing around really freaked me out the first couple of weeks or so. And people ask the same questions all the time. How was it? What was it like? What did you do? Da, 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 da. And I was kind of played it down, went on a trip, did a bit of work around it, did stuff around it. I don't want to talk about, you know, trivial things like someone's watched on Gogglebox. It wasn't interesting to me. It's not, I was going to die that day. You know, and I remember I was having a busy night in the emergency department. You know, a lot of people had been stabbed and shot at Whitechapel, and they're saying it's really terrible, it's really terrible. And I said, well, no one's trying to shell us, no one's trying to kill us. You know, it's not that big a deal. And they looked at me like I was a spaceman, and they're kind of right in that my level of concern had changed completely in that period of time. And it's true, you know, no one's trying to kill you. Isn't that just such a bad day? Anyway, so what do I learn about doing this kind of work? Okay, first thing about it sounds ridiculous. Look after yourself. You know, look after yourself. Before you look after other people, you can't do good clinical care if you're not well yourself. Okay, that's me having a lovely shave and after my deployment. Second thing about it, no matter what you think about medicine, about you being apolitical, you are political. If you're in a conflict zone, looking after one side of a conflict, you are by definition part of the issue, and you are political activists in that places. You may say nothing. I remember as a humanitarian, I spoke very clearly about the lack of resource and the lack of access to support for individuals in those spaces. I was perceived as being political when I was being very apolitical. I was perceived to be taking one side of it. Also, adapt. That thing in the middle is actually a pizza cutter, okay? And we didn't, when I was taking skin grafts, because I didn't have a skin mesher to make the skin grafts bigger, I had to cut little grooves in that pizza cutter and use it to mesh my skin grafts so they can go further. If you haven't got kit, you have to improvise, yeah? The next picture is about us doing training in our emergency department to make sure that our local doctors were skilled in doing major trauma pieces. Yes, they're super experienced. Yes, they're really great at what they do. However, they hadn't been trained in mass casualty practice in a different way, and that we just help them become better at being themselves. It's great, yeah. And last in life, everything you do is really important. Every life matters, even the BBOs, even the people you don't like, the people from Hamas or Al Shabaab or from Kogat or from the street or from the militia, from the Muqtas. Everybody, okay, is important to me. The adults, the children get care. Everybody gets sorted out. We do our best by them, and we remain neutral and impartial. It's really super important, or we're going to struggle. All right. And this last, okay, stuff is important. Every contact counts. Every bit of work counts. Anything you do, sharing a sweet, sharing a story, is massively important. Okay. The Gazans are incredibly kind and incredibly grateful for our support. They know we don't need to be there. They know we chose to come here to support them, and they recognise our contribution and the risk we're taking by going there. It's really important to them that we are hearing their stories, sharing their stories, and doing the work. Do not underestimate the impact of just being a human being in those spaces. And it's important to understand that, you know, as a clinician, all I'm doing is operations and saying, literally putting plasters on injuries. Okay, this is a political issue. It will be resolved by political people, you know, and I'm not there to stop. I cannot resolve the problem by being a good doctor. I do not hate warriors. I know that in certain circumstances, young people are encouraged or compelled to commit acts of violence they would not normally do in other scenarios. And that can be on either side of a debate, okay, either side of a conflict. I don't hate those individuals. I hate what they do, and I hate the people who make them do those kind of things. But I will not beat up on a kid who's been made to carry a gun and shoot somebody. That is what happens sometimes. I'm afraid that can happen to you and younger than you in this conversation. All right. So we're here as clinicians to hold the line while the politicians start talking and resolve the issues, because every conflict ends with a conversation, same as every conflict starts with a conversation. I'll stop there, shall I? Okay. Boom. Okay. Over.
Martin, thank you so much. That was a really impactful and moving talk, and that, I mean, there were so many bits in it that really struck me. You know, the comparison between working in London and in Gaza, that was really striking, and that bit at the end where you were kind of discussing how your role as a humanitarian healthcare provider, you know, being kind of both completely apolitical and also, you know, completely bound up in the kind of politics of the situation. And yeah, I feel very moved and impacted by your talk. So thank you so much again for coming and sharing that with us.
Oh, it's an absolute joy. I appreciate a lot of people. It's quite difficult information, and you may well have an opinion about what happens in the conflict zones. But as a humanitarian, you have to put that to one side and do the work, because you're there to do the work, and you're not there to advance your political views around it. Though it's very hard to be neutral when you see people being deprived and malnourished, when there are resources sitting 20 k's away you could access it if you had that support around it, and you get the sense that things are being done in a purposeful map that doesn't map to the actual scenarios you're looking at it, and that's very difficult. That being said, somebody has to do this work. Somebody has to engage in these processes. Somebody has to care enough to be there. And if we are there, then we know less people will die. And that's all we can do. We have to be there, and we have to be neutral. We have to get the practice done, or people will continue to die. And if we share those stories in the right way, that will make a difference to people's lives. But it's just the way it has to be.
Thank you, Martin. We have some questions that have come in to the chat, so maybe we'll get to some of those. So Mona has asked, how can we get to do activities like you, going to different countries and being involved in humanitarian work?
Brilliant question, man. And I think it's about, we are very clear that when we deploy to support and add value. Okay, we don't deploy very junior doctors and nurses and therapists. You need to be an independent practitioner, so pretty senior in your practice. So in terms of clinical practice, most of our staff are seniors, they're consultants or that level of practice. In terms of what you can do and what we've done in terms of our students, undergraduates, etc., they do a lot of teaching and training remotely. Bits around it, they provide support in those areas around it, they buddy with individuals. If we get kids out of Gaza, etc., we get them, we support the students, will support their pieces around it, and we've released lots of our educational material for access free of charge to the kids who are studying in medical school in Gaza. There are a couple of medical schools in Gaza on the West Bank which we support, and I think that from my point of view, what's important to appreciate that whatever you do, okay, is helpful. If you are providing kind words of support to a family member of someone in Gaza, that's a really important contribution. If you are learning your job better and you're supporting an individual working at space, that's better. If you're sharing your materials, that's better. And if you want to deploy as a clinician in those spaces, then get those skills, okay, and work in and around those people and do that work. However, we cannot have you out there if you're not independent practitioner. You just will not do that. And we've got lots and lots of brilliant clinicians in Gaza, for example, who can do the work, who just need an old grey beard like me to help them do a bit of practice, and just to make sure they're a bit more coordinated. And it isn't about me having a bit more skill set, a bit more experience, and just having been there, a couple of hundred times rather than once or twice. And that's, I think, that's the value we add. And we're just nice, kind people who just
Yeah.
take the heat out of a bad situation. Yeah.
Mhm.
But I think if you want to do the work, there are so many options you can take into it, and I'm very happy to talk to you about it if you want to down the road.
Amazing, thank you. Yeah, I think that's a brilliant message that, we all have a part to play, whether that is someone who has the clinical skills to go and do that, or as you say, to share kind words or stories or education. There's things we can all do based on the skills we currently have and what we can work towards. Um, let's see what else we've got. Uh, Abigail has asked, what helped you cope in such a stressful and emotionally demanding setting?
But it's funny actually. So I am a trained trauma surgeon. Guns
Mm.
and knives are what I do for a living, so that bit was actually quite straightforward. That's like just getting autopilot, just slightly busier. I think in what you're not used to is deprivation and witnessing the kind of loss, okay, that you see, particularly children. You don't see that many kids are badly injured there. And you don't see the absolute Armageddon of destruction. Imagine if they're building you have a picture of the medical school behind you, Agatha.
Mm.
Imagine that you went home tonight and that you came back and that was rubble and flattened,
Yeah.
but not just there, but 10 miles either side of that, and that's all gone. As are your friends, as are your property, and that kind of loss is quite difficult. And I think you have to go into it knowing what you're going to get into, being prepared for that, having done the work before you go, that you're not unbalanced, okay?
Mm.
You're not
Mm.
really over dependent on other people, over dependent on substances, over dependent on support in that regard, and you keep on talking whilst you're there with your colleagues, and you share those stories, and you get it out, and you get upset, you do that piece around it, and when you come back, you take some time. You take some time and you talk with experts about it and professionals about it, and you share your stories with professionals, not your mates, they don't deserve it, not your partner, they don't deserve it, but with professionals who can help you guide your way through it. And then you take your time, okay? Some people aren't built for this. I know lots of humanitarians who are brilliant all over the world who chose not to go to Gaza because it wasn't right for them, and no problem with that whatsoever. It's a hard place to be, okay? In South Sudan, there were 14-year-olds shooting at me who were just drunk off their mind and angry, and they knew I had cash. So they shoot at me, and it was just one of those things. In Gaza, they shelled up their tent quite close to the compound when I was operating on my second or third night there, and they killed someone very close to where I was working. And it shook the whole place, and I thought to myself, I made a big mistake here. But after a while, you get used to it, like noise at a kid's party. But you have to understand that what you're doing is really, really abnormal. If you look at the photographs of me over the month I was there, my face gets tighter and tighter and tighter and tighter and tighter. So you need to decompress. And I think knowing what you're getting into, having a plan, having support, having good friends, having space around that, okay, makes it easier. But if it's not for you, it's not for you. And if you
Mm.
don't like it, unfortunately in Gaza you can't get out. So before you go,
Yeah.
you're going to be sure. There's no way, there's no easy, you can't change your mind, put your hand up and go out. You're going to be there for a month, whether you like it or not.
Yeah. Absolutely. Absolutely. Let's see. Um, Emma says, if you could do your medical career again from the start, what is the one thing that you would change or do differently?
Oh, that's a brilliant question, Emma. And you know what? The answer is nothing. And you know why?
Mm.
Because if I look at my life where it is now, okay, I've got all these silly hats and titles, all right? This incredible job, incredible family, incredible friends, all right? I passed and failed. I failed so many exams as an undergraduate and a postgraduate. I had just an arduous training, but I always laughed every single day. I made the best friends, okay? And where I am now, the journey I'm on now, I've always enjoyed the journey, okay? It's taken me to good places. So, oh yeah, it could have been easier, it could have been smarter, it could have been better at rugby, it could have been a bit thinner, or a bit more handsome, a bit more this, but a little less of an idiot here and there, a few less beers, a bit more revision, never know. But actually, okay, I'm exactly where I need to be, all right? And my advice to you is don't worry about what ifs, okay? Enjoy the journey, make your choices, and deal with them, because that's what life is all about. You don't get do-arounds, okay? You're going to make mistakes, you're going to fail things, you're going to be unlucky, you're going to be discriminated against for one reason or another. That is the life you're going to live, and you're going to get through it, and you're going to get better. And things that were great at one time are bad a year later, and are good again 10 years later. But when you look back on your journey, you are better for it. For those negative experiences, you're better for that failure if you process it appropriately. Okay, and as long as you're trying to be curious and be reflective in a positive way, everything that happens to you is a good thing one way or another. So now we'll change nothing because it's all turned out so brilliantly. I'm talking to you, for example. This is on a Wednesday night. It's not that bad, is it? So I think I don't want to go around again and have regrets because life is too short for regrets. And I think to you, if you make a mistake, yeah, I didn't do the right thing, won't do it again. But what can I learn from it? And it is what it is. Let's just move on. Don't change a thing. You're perfect as you are. You genuinely are.
Yeah. Yeah, I love that. And I think it's what you said earlier, wasn't it, about your personal philosophy being, I don't mind failing, but what I'm not okay with is not trying. And it's true, isn't it? We learn so much from our failures. They're such an important part of the journey.
It sounds really trite, about this. When you failed my end of year exam in the first year and the second year, I thought my life was over at the end of career. It all turned out fine, and I think you just got to understand why you failed. Didn't work hard enough. Didn't work the
Yeah.
right way. Got carried away with the soil. Had a hype between too much mucking about, not working. But look at that lesson. And after that, it was all plain sailing.
Mhm.
Yeah. So failed year one, failed year two, had to resit exams, honours graduate. Wasn't stupid, just didn't
No.
work properly.
Yeah.
And you're good enough, to get in. You're good enough to get by. Each and every one of you wants to do medical school. The grade, the card isn't that hard. Getting in is tricky and actually passing the degree. But it's about you enjoying that thing and enjoying those journeys. And there's more than one way into medicine, okay?
Mm.
It doesn't end at 17, 18, 19. I've got guys who went into medicine in their 20s and 30s and are brilliant clinicians. Had great life stories, okay? People who left medicine, it wasn't right for them, and had great careers as well. One of my best friends is a solicitor who left medical school after 2 years and is a fantastic solicitor and loves that life as well. And we're lifelong friends, 40 years in, still great mates, even though he left that course at 2 years because that's how important it was for him to not be in that place. It's never bad.
Brilliant. Um, oh, this is an interesting question from Oliver. Oliver says, you mentioned the feeling of guilt that arises after a patient is killed after the fact, despite your best efforts. Do you find a similar feeling arises in your clinical practice when dealing with repeat victims of interpersonal crime in the UK, or is that a different experience?
It's kind of similar. So when I started working as a trauma consultant, okay, I used to see guys come in all the time with repeat custom. Some of them had the same ID tag on their wrists. They'd only been out a couple of weeks or a day or two, and that made me kind of angry and really hacked off. But rather than just raging, I thought I'd do something about it. So yes, I felt the same sort of disenfranchisement and powerlessness. And what I did was I helped build a Barts Health program to
Mm.
support that, and it turned out really well, and it led on to another career. Yeah, so that negative experience, okay, drove me to make changes and do things I thought were just going to make a small difference, but that snowballed into a bigger piece of work which I engaged with. I was curious and I had an opportunity, and it built this another amazing career I've got to help me add to my portfolio of things that I do. So when bad things happen and you feel guilt, ask yourself what you're feeling guilty about. Put the emotion to one side, look at the data. I know it sounds kind of dry to do that, okay? And then see what can I do about that. And you know what? There's always something you can do. It might just be words, it might just be, bits and pieces around it. It might be thinking differently or acting differently. But had it not been that negative experience, I wouldn't have built one of the most successful healthcare vital programs in the world. Go figure.
Yeah.
Go figure.
Yeah, that's powerful. Just to think, when you're experiencing something like that, to think, what can I do? How can I change this? How can I make a difference?
Yeah. There are lots of people who
Ah,
share the same view as you. They will have the
yeah,
same idea. I think it's really bad there. But very few of them will take a chance, take a risk. Because I just
yeah,
don't want to, stay in my lane, this is a problem. I don't know what I don't want to do about it. I'm happy where I am. What can one person do? What can one person do? More than know people is my answer. Okay? And if all you do is share a story, okay, or make a point, or get that stuff around, or get your charity raised, like raise an extra penny, that's something significant. That's a life saved somewhere along the line. That's an attitude change. That's a conversation that changes someone's view. That's someone you can resonate with, and you're not on your own. You're not crazy. You are correct, and all that stuff matters. You know, your head, don't let your head drop. It's hard. It really is hard, but
Yeah,
don't give up.
absolutely. Um, uh, Zach asks, would you say that your month in Gaza helped shape you to be a better doctor with better clinical skills?
No, I said make me a better person,
Mm,
and that might have a knock-on effect. But it wasn't about my. I wasn't doing any operation I hadn't done before, or medicine I hadn't made before. But I hadn't been working in an environment where I was so resourced at Race House Limited and so humbled by my colleagues who did network around it. And I became much more reflective, much more humble, much kinder, much less grumpy. And that, okay, I think might make me a better doctor. But it wasn't the cutting. It was the people who were being so supportive and so kind and so grateful for my limited skill set in that spaces. Yeah. So nah. Not what makes you good is not the technical stuff. You can teach a monkey to operate. But to know when to do it and how to be kind about it, that's a real skill. And that's trained by experience and practicing humility. I might not sound very humble right now, but I am greatly indebted to the people I work with. I've been trained by so many brilliant people in my career who've been very kind to me for no reason other than they could be. Okay. And I think you just gotta don't focus. You've got the skills, you've got the hand skills, hand-eye coordination, that's all fine. But can you make the decisions? Can you deal with the consequences of your decisions? Can you work collectively? Can you change your mind and be flexible? Can you learn from other people who are less qualified than you, less expert than you, but are right? You know, if you have that dialogue with people, you can learn a huge amount. You know, and I think that bit I learned a lot about. The cutting, yeah, not so much.
yeah, yeah. And I think I just want to say, Martin, what you just said there about you're not sure if you sounded um, super humble, but I think your humility is something that's come across really clearly in this talk, and you know, I think is quite incredible for someone who who has been so successful in their career and done such impactful, important work to be so humble is yeah is
Well, I didn't go into it to be anything other than what I do. It's just a job, isn't it? You know, and if you want to have the big bright lights and chase after that, then you go do it. There's people who do that. You can be on YouTube and be a healthcare influencer, and you can be doctor is or whatever it might be, and whatever you want to do. That's great. That's if that's what you want to do. That's absolutely fine. But you know, just do the work and be good at it. Be good at what you do. You know, that should be enough. A lot of people struggle with being content, right? And name what enough is. Okay, if you're good at your job, okay, and you're a good clinician, and you're a good person, and you're a good partner, and you're a good friend, and you're best to be an okay dad, all right, and you're honest more often than not, and you try your hardest more often than not, and you learn from your mistakes and try not to lie to people, that's a brilliant life, you know. And the stuff comes. I didn't bank on all these silly titles and hats. That's not. It's not in it. I'm not in it for any of that. If I wanted that, I would try a little bit harder, wouldn't I? Really, you know. But that's not the thing. It's about can you do stuff and recognition comes when it comes. No, you know, at heart, I'm still wondering when I'm going to get pinged for being a muppet and get sent back down to nursery because my degree was a faker, and you know, I it's easy to get swayed by the hype to believe in more than you are when you get all these plaudits and laurels and nonsense. My advice to you on that one would be to have children because they don't really give a toss about anything you do. Sorry about the language. All they want to do is have their fish and chips as it's downstairs and their chicken burger. And if it isn't on time, that's my fault. So actually, it's all irrelevant. All the hats and whistles and bells don't matter. You know, they haven't got their tea. And I think that and having a real life outside of your job is kind of important. Go home
yeah.
to something important rather than just be filling your head with all this cutting and sewing and nonsense. That's just your job. That's what they pay you for. Okay. But the parenting and the partnership and the friends you make, that's the bit that really matters. And going home to that gives you all the balance you need. Yeah. And it's not. There's no point in being cocky with your kids, is there? They're going to laugh at you. What's the big deal?
Well, I think that's a brilliant note to end on. Actually, we're at the end of our time, and there are loads of questions in the chat, Martin. I can send those to you
Yeah,
after, so you
brilliant,
can
brilliant. No
have a
worries.
look at them. And
Of course.
I think it really, just as I said, you know, it really impacted me and moved me. I can see from the audience's questions that it had a real impact on them too. So just to say again, thank you so much for coming to speak to us and giving up your very valuable time to be here. We really appreciate it.
No, it's an absolute joy, guys. Look, if this is something you're interested in talking about, medicine or whatever it might be, then brilliant. Take it on. For some of you, this is right. For some of you, it isn't. It doesn't matter. Just swing the bat, see how it goes. You'll find the right thing for you. You'll find your tribe. It will happen. Okay. Be confident in yourself. Okay. Don't do what people tell you. Do what's right for you, and it will be all right. Yeah. So what's out for me, and I've got limited skill set. Okay. So look, enjoy. Thank you for your time. I really appreciate it. Have a lovely evening, a lovely weekend. Hope the sun comes out again, and I'll hopefully see you on the wards. Take care.
Brilliant. Thanks, Martin. Thanks everyone for being here, and hopefully see you next time.
Okay.
Good evening, everyone. Bye.
Bye bye.